And so my goal today is really to just give you an overview of Illinois public benefits with a focus on those state of Illinois benefits administered by the Illinois Department of Human Services. So that's my overall goal. I would like to take just a brief moment and tell you a little bit about how I came to this work. So I've been with my agency, the DuPage Federation on Human Services Reform, for about 7 years. Prior to that, I spent most of my career working in public health, and I did a lot of different things, but the majority of my time was spent working in the HIV field, both on the prevention and the case management side of things. So when I came to the Federation, I didn't know a whole lot about public benefits like Medicaid or food stamps. I would have the occasional client that might be eligible, but I worked in that field prior to the Affordable Care Act passing, and so a lot of my clients were single, maybe didn't have dependent children, and therefore they could not qualify for many benefits. So I've learned a lot in the last 7 years, and one of the things that I've learned is that it's a complex system. The other thing that kind of threw me when I first started working is that each program has its own eligibility requirements. And so that can become very challenging for individuals and families when they are applying for multiple benefits, because maybe some people will qualify for one benefit and not the other, and then they don't know where to turn. So anyway, my goal is to give you an overview. Please know a lot of my work with regards to these programs and policies, I can get very detailed, and I tried hard not to do that with today's presentation. But if for some reason I do start going down that path, just bear with me. Sometimes it's good to just listen to all of the information, and then my hope is that you'll know where to look for more information or to come back to it. So, navigating public benefits in Illinois. This is just a sampling of our state agencies, but just so you know who has authority over many of the benefit programs in Illinois or other resources. And some of you through your work may already be familiar with some of the more frontline providers that actually carry out some of the programs that these agencies administer. But I thought it would be good to just think big picture for a moment. Today's presentation will focus mostly on the benefits that are administered through the Illinois Department of Human Services, or IDHS for short. Many of us in the field will call it DHS for short, but there's always a risk of them confusing that with the Federal Department of Homeland Security, and I do not want to do that. So for today's purposes, if I do say DHS or IDHS, this is the agency that I'm referring to. When we talk about our Department of Human Services and we talk about the local offices that are serving customers, that's their terminology for clients who need benefits, is customers. They actually call them FCRCs for short, or Family Community Resource Centers. So you'll hear me possibly refer to a local office with that lingo as well, but just know that I mean that local office that's placed in the community. In Lake County, that local DHS office is located in Waukegan. So some people refer to it even as the Waukegan Public Aid Office. And this is the office that has caseworkers who will process the applications for Medicaid or SNAP or cash assistance. They also communicate with the customers, renew those benefits, and do a lot more. In Illinois, we also have the Illinois Department of Healthcare and Family Services involved in public benefits on the Medicaid side of things. And so it is important to just note that sometimes clients do receive benefits or communication from this department as well. Now, this department, HFS for short, doesn't have any local offices, but they do write the policy when it comes to Medicaid, and more importantly, on the provider side of things, they're the ones who pay the providers for any care received by a Medicaid recipient. They also contract with and coordinate or manage, I guess you could say, what we refer to as the Medicaid MCOs, or Managed Care Organizations. And I will talk about that in a little while. I have a slide all about it, but just know that in Illinois, our Medicaid system is a managed care system, so we have insurance companies actually coordinating the Medicaid benefits and care for consumers or clients. And then I did throw in here Illinois Department of Aging. We don't necessarily do a lot on the public benefit side of things with this agency, but I think it's an incredible resource to be aware of if you're not already. For seniors, they have some different resources on their webpage that can get you down to the local level with everything from community dining resources or Medicare assistance in particular with the Medicare program, and just some other things as well. So maybe different food resources or other community resources specific to seniors. And of course, the elder abuse hotline is also run through this agency as well. Now, I could keep going and get into all sorts of different agencies like public health and employment security, but again, focusing on some of those state benefits. And so today what I really want to talk about is just giving you an awareness of some of the basics around Medicaid, which is healthcare for low-income populations, SNAP, or the Supplemental Nutritional Assistance Program. Also talk about a couple of the different cash assistance programs available in Illinois, and then briefly touch on Medicare Savings Program, which is a way that the state can help people pay their Medicare premiums. So that's kind of my agenda for the day, is to kind of get into some of these different programs and then also discuss resources and where to find more information. But when we think about agencies who are working with families or individuals in need, looking for benefits, one of the things we often talk about is, well, how do we know what's the right program for a family based on their needs? And so some agencies maybe do a formal screening on all sorts of things, you know, housing needs, food needs, healthcare, school and education, you name it. But when we talk about some of these benefit programs like SNAP or Medicaid, you know, thinking about which program would be a good fit for which client kind of depends on a lot of different factors. And so in general, whether it's these state of Illinois benefits or even some of the federal benefits that are out there like Social Security and Medicare, maybe veterans benefits, which is not something we're going to talk about today, but there are different programs out there from different sources. That really comes down to something called categorical eligibility. And all that term means is really, does the individual fit into a category that then opens up a pathway to a certain benefit? So if someone was interested in VA healthcare, or maybe some of the VA cash assistance program, or the VA housing assistance, foreclosure prevention, and homeless assistance, they can't access those benefits unless they're a veteran. The individual would have to fit into that category having served in the US military. So that's just one example of categorical eligibility. With Medicaid, you're going to hear in a moment how in our Illinois Medicaid programs, we have different categories for different populations based on age or pregnancy status, possibly disability status, and more. And the other thing to think about when it comes to these benefits is that sometimes there's also some cutoffs in terms of age as well. And this is not the training for getting into those kind of details, but just know that each one is a little different. Income obviously is a big one to determine whether or not someone might be eligible for one of these benefits. And so we'll spend a little bit of time talking about just some of the income guidelines for the different programs. And then assets. Some programs do care about the property that people own or the money that they have in the bank, among other things, but not all programs do. And I know this may vary from state to state, so I think it's important to just note that not all programs will count assets. Some do and some don't. And so that's just another example of just how complex the eligibility for each of these programs can be. And then also, to qualify for some of these benefit programs, they may have other qualifiers as well. And I am going to take a few moments to get into just briefly the definition for qualifying immigration status for an individual to be able to access benefits. But know also that depending on the type of program that someone is applying to, you know, who goes on that application and whose income counts, that can vary. It can be because of relationship rules. It might be because of other rules that the program has. You know, do they live together? Do they file taxes together? Do they live separately but still file taxes together? Sometimes that can impact someone's access to public benefits. To get any of these benefits, they have to be an Illinois resident when applying. There is no minimum threshold, though, for how long they have had to have maintained Illinois residence. What I mean by that is someone can move to Illinois today, and if their intent is to reside here, to domicile here, I think is the state terminology for that, but if they are, for all intents and purposes, going to be an Illinois resident, they don't have to have been here for at least a minimum of 30 days. They could do the applications immediately upon arrival. The challenge will be, how will they prove that they are an Illinois resident? And so that might be something like school enrollment records for children. It might be showing a lease that indicates that they are, you know, have a place to live. There can be other proofs as well. So no minimum threshold, but have to be able to prove that they are an Illinois resident. And sometimes there's other requirements as well, especially with some of the more specialized programs. But that would be a training for another day. So let me talk briefly about immigration status and access to public benefits, because there's often a lot of confusion and fear around this. And this terminology of qualified alien actually comes from federal legislation back from 1996, when they revised or reformed, I guess you could say, some of these benefit programs and the eligibility. And so this actually is a federal definition that to access government benefits, in general, a non-citizen or an immigrant must have this qualified immigration status. What is a qualified immigration status? Well, for persons who enter either through family-based sponsorship or perhaps through employer sponsorship, once they get their green card or their LPR status, lawful permanent resident, once they've had that in place for 5 years or longer, then they are eligible to apply for benefits. They still have to meet all the other income requirements and Illinois residency requirements, but in terms of that immigration status, they've had green card or LPR status, it's the same thing, for at least 5 years. So that can be a challenge. Sometimes we have immigrants who are newer to the United States. They maybe have been here 2 years and maybe they are having a hard time finding work or having a hard time making ends meet. But unfortunately, if they've only been here for 2 years as a green card holder, they are not eligible to apply yet. And there's some other special rules too, but I can point you in another direction for more information on that. A couple things complicate this. That's a pretty straightforward definition, and you'll hear often in the immigrant community about, oh, there's a 5-year waiting period or a 5-year bar on accessing these benefits. Well, one of the complicating factors is that there are actually some special rules related to humanitarian status that do not have a 5-year wait. And most often we see this with refugees or asylees. It's a special protected immigration status, and so if they have entered and been resettled here as a refugee, they are able to access public benefits immediately without the 5-year wait. And there's a number of other different qualifying statuses as well. The other complicating factor that's not on the slide is this is usually referring to federally funded public benefits, but not all federally funded public benefits fall under this rule. A really good example is one that I was just going to talk about briefly later, but it's popped into my head now, is things like the National School Lunch Program. So when children get free and reduced school lunches or apply for free and reduced school lunches here in Illinois, they do not have to have any qualifying immigration status. They could be undocumented non-citizens and still be able to access that food benefit. So this is a really confusing thing. I mention it because I think it's just an important point to know that it depends. And so sometimes that might be all that you say to a caller, and then what you'll want to do is refer them to an agency who maybe is very well versed in these benefit systems and can answer these detailed questions a little more closely. Okay, I'm going to stop there just because otherwise I will keep going. The other thing that's important in Illinois is we do have some exceptions with when the Medicaid, with the Medicaid program and immigration status. So this is another exception, and it's a state, some of this is a state decision, and some are also federally protected programs as well. So in Illinois, pregnant women and children through age 18 up until they turn 19, they can access Medicaid regardless of immigration status. So there is no requirement there. And that's really important to know. The coverage for children is known as All Kids, and it's been around for quite a while. There's also a program called Emergency Medicaid for non-citizens, and that is a program where perhaps an immigrant does not have that qualifying immigration status for Medicaid, but otherwise they would have qualified because they were low income, and they end up in the emergency room because of a life-threatening sudden illness or injury. And this program, really all it does is provide coverage for that ER visit and possibly anything inpatient that is related immediately to the emergency issue. Usually hospitals are helping these individuals apply for the emergency Medicaid coverage because that's the way they get reimbursed. Because you can imagine if it's a low income, undocumented immigrant, maybe they don't have health insurance, and then they end up injured on the job and end up in the emergency room. Well, who's going to pay that bill if they're very low income? And yes, the hospital could possibly offer a charity care application, but this is actually a way for the hospital to get reimbursed for this coverage. I mention it because due to the COVID-19 public health emergency, our state has put COVID-19 testing and treatment under the umbrella of emergency Medicaid. So I did want to just spend a little bit of time talking about that. I don't know how often it comes up, but if that ever were to come up on a call, you can reassure callers that testing and treatment in Illinois is covered. There is going to be some sort of payer for them. And for many immigrants, it might fall under this emergency Medicaid for non-citizens, but providers also have some other funding that came through the Federal CARES Act earlier this year. So anyway, before I dwell too much further on that, I think it is important to just note that that is one of those qualifying conditions for emergency Medicaid. I'm also going to point out that Deanna has posted some of the agencies in the Lake County region that are well versed with working with immigrants on these applications and these rules. So Mano a Mano and HASAS, Catholic Charities, they have all attended not only mine, but some of the other public benefits training that is offered in the region, and so they are great referral sources. And I'm happy to learn of Most Blessed Trinity, so thank you, Deanna, for that. This should have been emailed out to you, and I don't know if it's more information than you need, but I emailed the most recent version yesterday, and so hopefully you have that. And just to run through what we're looking at, this is just a quick snapshot of the income guidelines for all of these different benefit programs. So on the far left column, you'll see number in unit, so that's kind of the number of people in the home or in the benefit unit. And then across the top there with the different columns, you'll see different terms for different programs. The first three columns are the income guidelines for the Medicare Savings Program. Then you have in the purple column the SNAP income guidelines. So I will say this screenshot is just slightly out of date, but the version you received in email was updated because our SNAP guidelines are going up October 1st. The TANF payment levels, the state has not yet released this, but my understanding is that the TANF, which is a cash assistance program I'll talk about, those payment levels will be going up October 1st as well, but as of today, they have not posted what those levels will be yet. And then starting with HBWD, these are your different Medicaid programs and the different income levels. HBWD is health benefits for workers with disabilities. It's a special Medicaid program. I'll come back to all of these in a little while. But then you can see we've got family care, ACA adults, different all kids income levels. And for all of these state programs, these are gross monthly income levels. So if a family of 4 is applying for benefits and they need both SNAP and Medicaid, that family of 4, if they're all under age 60, up until October 1st, their income needs to be at or below $3,541 a month, and then they could be eligible for SNAP. But for Medicaid, look at the difference. For the adults, we would look at the family care ACA adults column, and it's a little less than that at $3,013 a month for a family of 4. And then the children, the family could earn a lot more. My reason for showing this to you is just to understand that is part of the confusion that families sometimes have. They applied for multiple programs. The kids might get all kids, and the adults might be denied Medicaid, but then they might actually qualify for SNAP. And so it can be very confusing. And this is where we would, again, refer to community agencies who have kind of these benefits specialists or client access assisters who are a little familiar with navigating the system. Real quick, there is, oh, yeah, and I will reply. I have a private comment question that I will reply to later. Okay. Yeah, feel free to enter questions in the chat as I go through this, and I will answer as I can. So I realize already that's a lot of information. So my next several slides, I'm hoping to just break it down a little bit more to give you some familiarity with the way some of these programs are run in Illinois. And we'll start with SNAP. So food stamps in Illinois, a lot of people call it LINK because it's our debit card to deliver the SNAP benefits is the LINK card. And SNAP is a federal nutrition program. It can be used, it's monthly benefits that can be used to buy food products only. During the growing season, they are allowed to use their LINK card for buying tomato plants or other plants and seeds to grow their own produce. Some of our farmers markets do accept the LINK card. And recently, we're very excited that Illinois was set up to start participating, and there are some retailers that can accept LINK to deliver groceries. So obviously with COVID-19 and especially early on, a lot of people didn't want to go into the grocery store and wanted to have their items delivered or at least available for pickup. And it was a challenge because people with SNAP benefits, that wasn't an option. It is now an option. The challenge is that right now it's only Walmart and Amazon that are set up as retailers to accept SNAP in Illinois or LINK in Illinois. And I know they are working to try to get more retailers on board, but that's actually something that's between the retailers and the U.S. Department of Agriculture. It's got nothing to do with the state system. So. But that is something to think about. So people could technically order from Amazon Fresh or Walmart grocery and have their groceries delivered through use of their LINK benefits or their SNAP benefits. In Illinois, you can get SNAP. Obviously, you have to be an Illinois resident, citizen, or a qualified non-citizen. Those rules are in effect for SNAP, and they have to meet the different income limits. And so as of next week, these are the October 2020 new income guidelines. You can see a household can earn as a single person up to $1,755 a month and possibly qualify for SNAP. You see 3 different income levels on this chart. Non-QM, that's a non-qualifying member household. It just means that everyone in the household is under age 60 and no one in the home has a disability. And it's a straight gross income test, and if they're over this income limit, they're denied. If they are under this gross income limit, then the state will process the application and apply different deductions and look at what they pay in bills to reach what their maximum net income is. And it's really their net income that historically decides how much in a SNAP monthly benefit the person will receive. I'll come back to that in a moment. QM, qualifying member household, you don't need to remember all this, but just know that it's a little higher income limit because someone in the home is either age 60 or older or has a disability. And so there's some special rules and protections for those households. So you can see here a single person could actually have up to $2,127 a month and still qualify for SNAP. And they count all income, whether it's earned income or if someone's receiving Social Security, retirement insurance, or disability insurance, they count all income for SNAP. So I had mentioned, that third column on the previous slide, the net income is what determines how much in SNAP the person receives. And so these are the monthly benefits, the maximum that someone could get per month. And before COVID, and now probably moving forward, though it's kind of been a month-to-month thing recently, but let's take it back to before COVID-19, that net income really influenced how much they would get. And so sometimes you'll hear from seniors who are only getting $16 a month in SNAP benefits, and it's because their net income, like their Social Security check, is too high, and so they get a lower SNAP amount. And so it's just it just influences that. They are looking at all of these figures and kind of how that will work going forward. And there have been some special flexibilities put into place because of COVID, and not everyone on SNAP realized it. So I believe this is a state-by-state thing, like the state has to request it from the federal agency, USDA. But for the last several months, pretty much April through September, all SNAP households were receiving the maximum amount. Even if they technically, their income, meant they should only get maybe $30 a month because of the COVID emergency, they allowed the flexibility and all households were getting the maximum amount. We do not know if this will continue for October, but I recently heard from a family who has a son who receives SSI, so he has a disability, and they had no idea that their son had been receiving the maximum amount for the last couple of months. So they all of a sudden had all these SNAP benefits they didn't realize they had. We don't know if that will continue for October. Like I said, it's kind of been a month-to-month basis that USDA has been approving these requests, but it was just like this flexibility. And I do worry about people who won't realize that that's not a permanent thing and that it'll go away. So I just talked about that, the emergency allotments. The other thing I haven't mentioned quite yet is that with all of these state benefits, people have to renew their benefits at a minimum once a year. And sometimes, especially with SNAP, you might see that more often, or at a minimum, they have to report every 6 months what their income is and make sure that there's been no changes. And so during the COVID emergency, the state has been able to get approval to extend benefits. And so if someone's SNAP case was due for recertification in April, May, June, July, August, and now even September, they didn't go through that process. They just extended their benefits for 6 months. And again, I don't know how often you get calls about these benefits, but I think you could be a help in the fact that this is probably the last time in September that these benefits are being extended. I could be wrong, but all signs are pointing to, we're going to get back to the regular recertification periods. And so to let households know they need to respond if they receive a notice to report or to recertify, to renew their SNAP, that they do need to respond to that. And it's usually a pretty quick turnaround. So people whose benefits are due to recertify in October, they should have already received the letters from the state, and they need to turn that around usually by the 10th day of the month if they want to keep getting their benefits. So it's kind of a critical issue. And then just other food programs besides SNAP, WIC, Women, Infant, and Children, that's the specialized kind of more nutritious type of food, things like beans and peanut butter and dairy and so forth. And it's for pregnant women, breastfeeding women, and then children up to age 5. WIC is a program where there is no citizenship or immigration status requirement. So sometimes with our undocumented families, that's the only food benefit they can get at that time. Interestingly, WIC historically has been seriously in Illinois old-fashioned coupons. So I think you all are based in California, if I remember correctly. So I don't know what it's like there, but our WIC program has historically been these coupons that'll say you're allotted a half gallon of milk and a certain number of cans of beans, and it's just really old school, I guess is one way to say it. They are shifting though to an electronic debit kind of system, so that's exciting. In Lake County, people who have questions or need to apply for WIC would go to the Lake County Health Department. Also, free and reduced school lunches. I mentioned this at the outset, but this is a national program, also a food kind of security program for children who are in school. The key takeaway here is that they must apply with their local school, and they can apply at any time of the year. We would hope, they would do so at the beginning of the year, but obviously what we saw with COVID earlier this year is a lot of people all of a sudden were out of work, and as Deanna has pointed out in a comment, they may not have known about these benefit programs. So yes, they can apply at any time during the school year for this, and the different income levels will tell whether or not they're able to get free lunches or reduced school lunches. And please bear with me, let me talk a little bit more about this, because food insecurity actually has recently become a passion of mine. And with all of the disruption here in Illinois, many schools are either fully remote or doing a hybrid model. And some school districts have a lot of resources in the community and others not so much. Lake County, I'm going to guess it probably varies by town and school district, but I have seen that many schools have been able to respond and even have meals for families if their schools are remote learning and they just have to get there to pick them up. In other communities, we have like a local YMCA delivering meals at different times. So it just depends on the community. I also want to mention briefly, and I don't have a slide on but there's a lot of uncertainty, and I would just refer people back to community agencies or possibly even the State Department of Human Services. But last school year, there was a program called PEBT, or Pandemic EBT, and it's another food benefit program. It did come out on a link card, but it's not SNAP. But it basically is designed to replace the loss of those free and reduced school lunches. And so applications had to have been submitted by August 31st for families to be able to get these benefits for this past school year and possibly for the month of September. And then there's just a whole lot of confusion about whether or not it will continue for this school year. And part of that's due to federal budget timelines, and I'm just going to leave it at that. So more possibly to come on this. And really the takeaway, what I want to make sure people know is that to get PEBT, they had to have applied with their school district first and gotten on the free and reduced school lunch program for them to be able to access PEBT. If you've had questions from people who say, oh, I applied for this program, but they denied me and I don't know why, you know, I have, you know, the income or whatever, I should have gotten it. It could simply be something like the data didn't match up with their school, and then therefore the state school board of education, who then shares the data with the State Department of Human Services, who's processing these applications. So I realize that's kind of a lot going on. Just know it's been kind of a confusing rollout in Illinois, and some people may have been incorrectly denied. My takeaway about PEBT is to be sure they get connected with free and school reduced lunch program. And I don't know, right now with the way schools have had to adapt, each school district's different. It might be the secretary in the front office who takes those applications. It might be someone else, like a social worker. It depends on the district, but to refer them to their schools for sure. So any questions about food? You can either unmute or type. And at the end, I'll have some resources, but you're very fortunate. Lake County, the northern is served by the Northern Illinois Food Bank, and they have a network of food pantries. And so I know they have a team who's familiar with some of these food assistance programs. So it's a great resource for families as well. So let me shift gears then, talk a little bit about the cash assistance programs, programs available through the state of Illinois, and then also a local cash assistance program through the townships. So we'll talk today briefly about TANF, Temporary Assistance for Needy Families, AABD Cash, which is Aid to the Aged, Blind, and Disabled, and then also briefly the Refugee Resettlement Program. These are benefits that someone would apply for through that Illinois Department of Human Services. And then I'll conclude this section about GA, or General Assistance. So remember at the beginning when I said, oh, categorical eligibility? Well, to get this type of cash assistance program, TANF, definitely need to fit into the category of having children in the home. And it has to be relative children. So whether that's a blood relative, adopted, step relative, it has to be a relative child. Can either be the parent of the child and apply, and if they do, then the parent's income certainly counts. But it could also be a caretaker relative that is applying for this program. So let's say I take in my niece because she's not getting along with her parents so well, and I take her in. I could technically apply for TANF for my niece, and they don't, if I'm not meeting the TANF and I just want it for my niece, they won't count my income. Now they will ask all sorts of questions about her absent parents. That's actually how it's phrased on the application. They'll ask questions about the parents and want to know basically why the parents are supporting, or if they're supporting, or you know, maybe they're incarcerated or deported, or you know, there's some other reason why the parents aren't in the picture. And so that's all kind of teased out, if not on the application, during the interview process for this benefit. To get cash, pretty strict rules. And really, for this TANF program is really for very low income families. But it provides a monthly cash benefit. Very strict rules: must be a citizen or a qualified non-citizen. I mentioned very low income and have to be Illinois residents. I have a note on this slide. I debated whether or not to keep it because this could be its own training, but public charge and sponsor liability applies. What does this mean? Well, for immigrants who are applying for this program, or perhaps for their citizen children, this is a program which would be subject to public charge, meaning if the immigrant was planning to adjust their immigration status, maybe they're applying for a green card. In fact, that's when public charge is assessed at this time. If they're applying for their green card and the family was relying on TANF because the citizen children were receiving it, that could be a strike against the family. It's always been a part of public charge rules. It's basically public charge is when they apply for their green card and the government looks at whether or not they're dependent on government benefits for income maintenance. That's one way to think about it. And then sponsor liability, that's just a rule under family sponsorship, and that if someone maybe is a qualified immigrant, but they still have a sponsor who is technically financially responsible for them, then they need to include their sponsor's income on the application. So I know even with saying that, that's more information than you need to know, but I think it can be helpful to just understand that this is a pretty strict program, and a lot of people will not apply for it because of this, but also because there's some rules like this. They have to cooperate with a plan to leave TANF. So they have to develop a case management plan, essentially, and what are their goals. And they have to be either searching for work or applying for jobs or doing community service. There's a lot of program requirements with it. They also have to seek child support if they've not done that already and there's an absent parent in the household, so to speak. So a lot of rules, and you'll hear some people just not want to apply because of that. And then the other thing with TANF is it's not an endless source of income maintenance. It is limited to 5 years max. And so if someone, let's say, received TANF in another state, let's say they were living in Missouri, which is one of our neighboring states. They lived in Missouri for 3 years and received TANF in Missouri for 3 years, and then they relocate to Illinois. They only have 2 years of eligibility left for receiving this program. But the idea is that it's to help families who maybe are having a hard time making ends meet, helping them, providing some level of support while they hopefully gain other skills and find work. That's the overall idea. And it's not a huge amount. If you look back to that income chart that I emailed, you'll see that column is not the income limits for TANF, that's the maximum benefits that they would receive. So I want to say, for a family of 4, can't remember what it is right now off the top of my head, but it's not enough to pay rent on in Lake County, at least in most places in Lake County. So it's certainly not going to be most families' sole means of support. But it is something that is available to those families with children, children under 19, so really children up to the age of 18. Shifting gears, another cash assistance program is the AABD cash program. And so this is for persons who are either 65 or older, or if they're not 65 yet, they have a disability or are blind. And I know that this third bullet point, what does this mean, right? A person qualifies if their total needs exceed available non-exempt income by at least $1, excuse me. When someone applies for any of the state benefits, each program has different income counting rules and also different deduction rules. And so depending what a person pays in expenses, whether it's their rent and their utilities, or for this population, medical expenses and different things, the state will do kind of this calculation and figure out, okay, well, this is how much you should need per month to get by based on all of your factors. And if the person's total needs exceed what their income is, then they can get this cash benefit. Now, this isn't a huge amount, and sometimes what we see people who are receiving SSI, which I think is at $783 a month right now. I can't remember. That's the one of the federal disability programs for low-income persons. So let's say it's $783 a month that a person receives an SSI, but the state determines that they actually need $883 to get by. The state will give them $100 per month in AABD cash. So it's kind of how it works, or the easiest way for me to explain it. And then if they had let me go back. If they had no other means of support, like they weren't on SSI already, or maybe they were, but the SSI ended because there is a rule for refugees that they can only receive it for 7 years. It's a rule for that population of immigrants anyway. then they could apply for AABD cash if they were pursuing citizenship. And I want to say it's somewhere around $600. I can't remember if it's just under or just over that, the max that someone could receive in this benefit. So again, not enough to make ends meet usually in the greater Chicagoland region. And then Refugee Cash Assistance Program, usually the Refugee Resettlement Program agencies will make sure that families are accessing this because it's only available for the first 8 months of them being placed in the United States as a refugee, or from whatever date that they were approved and granted asylum. So they can only get it for a short time frame, but it's again to help bridge the gap and help them make ends meet while they kind of assimilate or adapt and find work and so forth. All right, so that's a bit about those state cash programs. And then since Lake County is outside of the city of Chicago, I think it's important to let you know also there is a program through your local townships called General Assistance. And this is a program throughout the state. Townships are another local unit of government within counties. So you've got the county and you've got municipalities or cities and villages, but then you also have townships. And often a township's geographic boundary will cross multiple city boundaries. And I think I do have a listing of what your townships are in Lake County coming up. But this is for people who don't qualify for other federal or state cash assistance programs. Or sometimes what we see happen is that someone has a disability application pending with Social Security, but it takes forever for them to make a decision. And so they'll go to their local township and apply for this program. And it's not a lot of money. It's, you know, I think in my area, I've heard of them like maybe max $250 a month. But again, when you're talking about individuals with low or minimal means, anything can help be a support. They need to apply with their local township within where they reside, so whatever township serves where they live, and have to just go through their application process. Some of the townships will make them do work fair or do things like volunteering, doing community service to get it. And then I've given you a link. That's what I've done, is I've given the link for you to refer back to later. I guess I did not list them all. But that is a resource that sometimes people don't realize. And also many townships, again, it depends because it's a taxing body that each township, their budget may vary, but some of them offer food pantries, some of them offer ride share programs for seniors or do some other senior programming in particular. So if you're not aware of them already, definitely explore what the townships might have available for folks. And this just kind of says the same thing, so to apply with the local township. All right. I'm going to shift gears then. I'm going to keep plugging along because I don't see too many questions coming in right now, but talk about health coverage options. And I am mainly focusing on Medicaid today, but I think it's important to make sure we know where to refer people if they are really desperate and don't know what to do. They lost their health insurance, now what? And so where people access healthcare really depends, again, on whether or not they fit into a certain category or if they have a job or not. So we'll talk about Medicaid, which is for low-income populations. I'll talk briefly in a few moments about the Medicare Savings Program, and to do that, I'll talk briefly about Medicare. But this is the federal health insurance program for seniors and persons with disabilities. And I've typed here that it's an earned benefit. When we have FICA taxes taken out of our paycheck, it's going to fund Medicare and Social Security so that we can get it when we turn 65 or if we become disabled. Many people may be lucky to get job-based coverage or group coverage through a job, so that's an option. Back in 2014 was the first year people could buy private insurance through the Affordable Care Act marketplace, also known as Obamacare. It is still around, and I'll give you some resources later around that for Illinois. Some people may have to buy private insurance, but they need to really be careful about that. So they might be purchasing an individual plan because they don't have it through their job. They might want to be sure they're either working with an insurance broker or working with a navigator or some other type of assister, certified application counselor even, who's familiar with both Medicaid and Marketplace. Because depending on their income, they might be able to get a better deal through the ACA Marketplace. The other concern why even at a minimum to work with an insurance broker is because sometimes people end up in short-term plans. They just saw the bottom line monthly price and they ended up buying a short-term plan, and it's not truly comprehensive coverage, and here they thought they had health insurance. So it's a very confusing issue for a lot of people. If it's a college student, maybe their university offers school-based health insurance, but not all do. And one thing that's not on here is charity care. So hospitals have to offer charity care applications to individuals of a certain income level. Some hospitals do that routinely when you have someone who's uninsured or self-pay when they come in for an emergency or something like that, but not all do. And so you can request that. And then I'm not familiar of other kind of charity care programs that might exist in other areas. Sometimes there are free and charitable clinics. I know there's one in McHenry County, in Crystal Lake, but I can't remember if you have a free and charitable clinic in Lake County right now. What you do have is your federally qualified health center through the Lake County Health Department. And so that is a source of primary health care for individuals who maybe don't have health insurance or don't have another form of health coverage. But let's talk about Medicaid. Oh, and thank you, Deanna just mentioned Erie Health Clinic in Waukegan. Thank you. And I know that name. I should have remembered that. But let's talk about Medicaid. So I said earlier, right, we've got all these different Medicaid programs in Illinois. And, you know, for the most part, what people who are applying need to know is just that they're applying for Medicaid. But behind the scenes, all of these programs have different requirements in terms of age and income. So All Kids is for children under age 19. Once they turn 19, they will shift to either ACA Adult Medicaid or Family Care Medicaid. So those two are for your adults. Moms and Babies is for pregnant women and technically children under age 1, the newborn, so to speak. But really what happens is we get those children onto All Kids. And then AABD Medicaid, that's that aid to the aged, blind, and disabled again. So for low-income seniors and persons with disabilities. And for the persons with disabilities, actually, it's for those who are on Medicare. Because persons with disabilities who are not on Medicare yet, they'll most likely get shifted into the ACA Adult Medicaid program. Why do we have all these different programs? Well, there's all sorts of different federal matching dollars at different rates for all of these different programs is part of it. And then with All Kids, that's really a blend of the National Children's Health Insurance Program, or CHIP, and then the state-funded coverage for undocumented children and some different income levels. So All Kids is kind of a blend of some federal as well as state-funded health care. Again, people just need to know that they're applying for Medicaid and it's health coverage. This just gives you a little more detail, breaking it down program by program in terms of, well, what are the requirements? And so just kind of those income levels. And later you can maybe look back at this if you're interested and compare, okay, 138% of the federal poverty level for a single adult and look at it on that income chart. And I think it's around 1,467 a month for that. So a single person who earns, you know, just under $1,500 a month should qualify for Medicaid as long as they're a citizen or a qualified immigrant. AABD, it's lower income. So I think for a single person, that's right around $1,063 a month or below. We do have a program in Illinois called Spend Down. Basically, if someone's over income in the AABD program, but they have a lot of medical expenses, the state will look at those medical expenses and kind of deduct that from their income and then turn on Medicaid for them. It's a really simplified way of saying it. It's kind of like an insurance deductible, but they have to meet it every month. So it's a program for the medically needy. Notice this program does require asset test. So they are limited to $2,000 in assets. Moms and babies and all kids, I mentioned earlier, but we'll bear repeating that there is no immigration status requirement, and you can see it's higher income levels for these programs. So all these different Medicaid programs. Women who do not qualify for regular Medicaid because either of immigration status or because of their income, if they get moms and babies coverage, it's good for the duration of the pregnancy and up to 60 days postpartum. There are efforts underway in the advocacy community to try to extend that to 12 months, but that has not gone into place yet. But I think, you know, each state might look at that a little differently. So right now in Illinois, it's up to 60 days or about 2 months postpartum. And then we have some different special Medicaid programs. I've already talked about emergency Medicaid for non-citizens. So let me know if you have any questions about that. Also, under the policy for emergency Medicaid is something called end-stage renal disease coverage. It's a limited Medicaid program. It only covers dialysis, and it's for non-citizens who meet the income requirements, but they don't have a qualifying immigration status. All it does is cover dialysis. It does not provide ongoing health coverage in other areas. Health benefits for workers with disabilities. This is for someone who is disabled and working, and they're paying taxes into the tax system, and it's like a Medicaid buy-in program. And so it's a much higher income level than an AABD Medicaid income level. And so it allows them to pay a monthly premium to have Medicaid coverage. This is really important for some of our persons with disabilities who might need Medicaid to help pay for residential services or home services. So it's really an important program that they can buy into it and actually work, and, you know, because that contributes to their overall wellness too, to be able to work. And then coming soon in Illinois, this is really kind of important news, is that senior immigrants who are low income and do not have a qualifying immigration status, starting December 1st, they will be able to apply for Medicaid. It's a special state funded program. I think we're the only state or the first state in the nation to cover this population, but you can correct me if your state does. This is huge. So it will be very low income, 100% federal poverty level. So very similar to the AABD program. They are not ready to start taking applications yet. The program will start December 1st, and they can start applying for this coverage then, and they can get backdating of coverage through September 1st. So this is good news, especially in these times of COVID-19 for a vulnerable senior population who might be at high risk, but that they'll be able to get Medicaid soon. The only thing with this coverage is it will not cover nursing home care. A lot of seniors nationwide rely on Medicaid eventually to pay for their nursing home if they're in the institution. And this new senior expansion for immigrants, there's just not enough money in the state budget to be able to cover that. But it's a huge deal that they'll even be able to get it for health coverage. So this is for undocumented seniors as well as seniors with even a green card, but maybe they've only been here 2 years. They haven't met that 5-year bar. Okay, Medicare Savings Program. First, let me answer, what is Medicare, right? So that's our federal health insurance program for seniors. There's many different parts. You might have heard of it, Part A, B, D. A pays for hospital, B pays for doctors, D pays for prescriptions, or they can do something called Medicare Advantage, which kind of combines it all into one plan, so to speak. Not everyone's eligible for Medicare, but most people who turn 65 will get it either on their own work history or their spouse's work history. So someone has to have a work history. That's why we have the senior expansion program. If we have a newer senior immigrant to the United States, they may have never worked or didn't work enough hours to accrue a work history for Medicare. The thing with Medicare, if you have the work history, you don't pay a monthly premium for your hospital coverage, but you do have a monthly premium for Part B or your outpatient coverage, and you also have a premium for Part D. But the Part B premiums, and I apologize, I don't remember what it is off the top of my head per month. I want to say it's right around $149 a month. That gets usually deducted out of people's Social Security checks. That's what they pay per month with Medicare. Well, for someone who's low income and on a fixed income, that can be a lot of money per month. And so MSP, or the Medicare Savings Program, is a way for low income seniors to get help with those costs with their Medicare premiums. So again, that income chart, the first 3 columns on that income chart are your 3 different levels of the Medicare Savings Program. QMB is right at or below 100% FPL. This gives the most help with the Medicare costs because it'll help pay for their Part B premiums. People who don't have a work history can buy into the Medicare program, and if they have to buy into Medicare, their Part A premium is $419 a month. So if they're really low income, though, here in retirement, the QMB program can pay for both. Again, people with work histories don't have a Part A premium, but they do have a Part B premium. The other thing QMB can do is help, like if they're hospitalized, they have like an 80-20, a 20% co-insurance usually, or they have a deductible that they have to pay when they're hospitalized. And so the state can actually help pay those costs as well for our very low income seniors. And then there's 2 other levels, basically up to 135% of the federal poverty level, that allows some help with their Part B premiums. So they apply for all of these programs in the same way. Either a paper application, they can apply it over the phone, or really what the best thing to do is to apply online. And especially, you know, the state offices have just reopened. I think the Lake County, the Waukegan DHS office just reopened last week, I think. And they're even still, they're short-staffed, they're just reopening. And so the best thing to do is apply online or call. But if someone calls in the application, chances are they'll have a pretty long wait time. We recommend applying online just because then you have a record of that application. So that's really one of the benefits, and they'll always be able to log into their account and pull up their application. I'm not going to get into this, but just know that we do a lot of training, a deep dive into all of the eligibility rules for the different programs. But I thought it might be helpful for you to have a reference slide and just see, oh, I see, for SNAP, they look at everyone living in the home who eats together, regardless of relationship first. So if you're eating together with a roommate, technically the roommate should go on the SNAP application. But then there's some other rules. So if it's a spouses who live together, they have to apply for SNAP together. Both income will count, even if the spouses are separating. So maybe they're getting divorced, but they still share a residence. Because they live together and are still legally married, they would still need to be in the same SNAP unit, so to speak. And then some other rules for children. Medicaid gets a little more complicated. And then TANF also looks at relationship to the people in the home. The takeaway is when they apply online, as long as they're answering those questions thoroughly, the state will do the calculation. We don't make the determination. You know, I have assisted many clients with Medicaid and ACA marketplace applications, and it's not up to me to make the decision. I just have to make sure the person understands the question and fills it out accurately. And so if they just list who's in the home, relationship to the other people in the home, and even tax filing relationship to the other people in the home, the state's system will then calculate their eligibility based on that. After they submit an application, the state of Illinois still mails everything. And so, you know, the time frame for them to make a decision varies. SNAP cases are supposed to be decided within 30 days, Medicaid usually within 45 days. Prior to COVID-19, we had huge backlogs in our Medicaid applications. The state has actually caught up a lot because so many of the caseworkers were working remotely. So we'll see how long that lasts now that offices have started to reopen. At a minimum with Medicaid, once a year, they will have to renew their benefits, and then I already talked about SNAP. I do want to talk a little bit about Manage My Case. They access that the same way through the abe.illinois.gov website, but it's basically an online customer portal, kind of like online banking, but for their state of Illinois benefits. So they can do a lot through Manage My Case. If they are approved for Medicaid, they are going to have to pick a managed care plan. This is the website to where they go. It's called enrollhfs.illinois.gov, and this is where they can compare plans. And so what they would do, they can either call or they can go to the Choose section and find health plans. In Lake County, the Health Choice Illinois managed care plans are Blue Cross Community Health, Meridian, Molina, and then Illini Care is changing over to Aetna Better Health. There's been some mergers and acquisitions in the managed care system. So folks are approved for Medicaid, and then they get that notice of approval, and then they get a packet saying you need to pick a plan. And we really want people to pick a plan that meets their needs, because this is like HMO style Medicaid. Each of these plans has different provider networks and different extra benefits. At a minimum, they have to cover everything Medicaid does, but they do a little more than that. And so it's really important that people pick a plan that meets their needs. If they don't pick a plan, they will be auto-assigned, and we have run into issues where clients are like, well, now, you know, my doctor's not in my plan's network. Well, you might have to change doctors because you might be locked into that plan for at least 1 year. So we run into some of those kinds of questions quite a bit. So that is a lot of information in a short amount of time. What I would like to do is spend a few minutes kind of talking about some common issues that we often see community agencies run into. I'd be curious to know if you get any calls that kind of relate to this or not. And then I'm going to conclude with a few slides with some resources and then open it up for discussion. So one of the things when it comes to state of Illinois benefits that we hear over and over again is how difficult it is to get a hold of the Department of Human Services. People will call and call and call their local office, not this 800 number, but their local office, and it's like a black hole. The phone never gets answered, or they leave a voicemail and no one ever calls them back. I do think in some regions that has gotten a lot better, and with remote work, the state had to really adapt some of those services. So we are actually hearing reports of better response time. But again, these state offices have just recently reopened, and so that, you know, I don't know what that will do to their response time. However, I would still encourage clients to do as much as they can by phone or by internet as possible. The local offices are reopening, but they have limited staff. They basically, it sounds like most of them have divided the staff in half, and they're on 2-week rotation. So half the staff come to the office to work for 2 weeks, then they go on a 2-week remote work again schedule. This is all trying to help with social distancing among the employees themselves. And the state has reserved the right to have to close offices again, depending on the COVID rates in their community. The other thing I've heard is that some local offices are kind of triaging or doing drive-through things. So I don't know what Waukegan is doing right now, and that might happen. So if someone shows up, they may actually never go into the office. If they can take care of the issue outside, they might try to do that. Some may say, oh, you just need to apply, well, go online or call. And again, it's all about trying to keep the social distancing. But, you know, if it's an issue that hasn't been resolved, someone might have to go go to the office, especially if they aren't getting anywhere via web or phone. The other thing to keep in mind is they have set up urgent call teams, and so we've definitely given this out to different providers, and often it's often the main number, but not always. So this link will take you though to the link with all the numbers for the urgent call team. And then I already mentioned this Manage My Case portal, but this is, again, the managing of their state of Illinois benefits. They can even email the local office through this system. Now, not everyone can use it because it does require some data security, electronic identity proofing to happen. But, you know, if they don't know what the status is of their benefits or they know it's time to renew, they can actually fill out the form online. So we really do encourage people to try to get through with this. But some other things that we often hear, well, my case got canceled and I don't know why. You know, sometimes it's because they didn't respond, or maybe they never got the mail. That's what missing notices is. I've heard this too often in Illinois, where someone never got a notice. To know that sometimes I think there is issues with the way it's sent out from the state, that maybe it shows on their side that it got mailed, but maybe it actually never generated the letter. I don't know. Just know that it's really important that they do try to advocate for themselves or get connected with one of those agencies that can assist with navigating this, because there's certain time frames. You know, with Medicaid, if they get canceled because they failed to turn in their proofs at redetermination, they have 90 days, and if they get those proofs in, they'll reopen the case, and it'll be like there was no gap in coverage. But if it's past 90 days, they have to do a brand new Medicaid application. So those are sometimes some things that happen. We see a lot of issues with Medicaid and finding a provider in those managed care networks. And so just to kind of refer them either back to Enroll HFS to try to find a plan that has their provider and network. They can even go to their plan. And I don't have it listed here, but sometimes you hear of issues where people are on Medicaid, they have a managed care plan. So let's say it's any of those 4 I mentioned earlier. They're having a hard time accessing a service, whether it's a specific type of maybe specialist or a therapy, or even accessing transportation. Just know that each of these managed care organizations is under contract with the state of Illinois, and they have service expectations. And they all have care coordinators. So these care coordinators are employed by the insurance plan to help navigate a lot of these things. Does the client need a referral? Do they need a prior authorization for something? Do they need transportation? Were they just discharged from the hospital? Do they need meals? Do they need other social services? These plans are being paid by the state to do that kind of coordination, the care coordination. And so often it's just as simple as educating the person. Have you tried contacting Blue Cross or Illini Care or whoever their plan is? Have you tried contacting them? Call the member services number. Ask for a care coordinator, because it's their job to help navigate that. And too often I hear of community agencies doing that. And I would be curious if you have other common issues that show up. We can discuss that as well. I think sometimes it's been challenging, especially during the last several months. You know, just not knowing when a benefit might be coming or if I'm getting a notice or not. So that's been a challenge. I should also mention real quickly before I go on, case cancellation for Medicaid right now is not happening. They want to keep everyone covered just in case of a COVID diagnosis. So they are not doing, they're not doing redeterminations for Medicaid right now, but they will start doing that for SNAP soon. All right, and this is just kind of talking about what I already mentioned, that for specific questions about their managed care plan with Medicaid, to contact the plan, and they can actually go to their plan's website and find a lot of different information as well. So who can help? So there's different community-based agencies. We've mentioned a few in the chat. Thank you, Deanna. Some might be authorized SNAP outreach partners. There's also immigrant and family resource program agencies, a few which were mentioned specifically. And then also sometimes health insurance navigators or certified application counselors. I know that the Lake County Health Department used to have quite a robust workforce, and I actually don't know if they're still doing that or not. But you might have many of your health centers who are still doing that work as well. So lots of different organizations can help. And what I've done is given you a few resources kind of in each area. So with Medicaid, this is just, again, Enroll HFS is where you go to find out what plans are in the area. Sometimes people have questions specifically about all kids, so I have included that hotline as well. But just keep in mind that other 800 number on the ABE application slide is the general DHS helpline, and they should be able to help as well. Get Care Illinois is something for clients or families or individuals. It is really user-friendly information about both Medicaid as well as ACA marketplace insurance and kind of what's needed and expected. So if you have someone who just needs to be educated about either of these programs, this can be a great resource to them. And it's in really, like I said, user-friendly, readable language. It's not too, it's not collegiate academic writing for once. And then Get Covered Illinois, that is really a go-to place for ACA marketplace insurance, a little bit of Medicaid as well. But if you needed to even find a resource in the area for assistance with applications, you can go to that website. With SNAP, I already mentioned Northern Illinois Food Bank is a huge resource for Lake County, and they have a network of providers. So they can actually go to the Solve Hunger Today website and search by zip code, I believe, as they can on Feeding Illinois as well, which is more of a statewide organization with resources. And then sometimes people run into trouble with their link card, or they need to set up the link card, or they need to check their balance. And the best thing to do is, in that case, is to call that helpline here. I know I didn't talk terribly much about seniors, but one thing I forgot to mention during the Medicare section is that the SHIP program is a huge resource to seniors in Illinois. So it stands for Senior Health Insurance Program, and it's a network of volunteers and sometimes staff at different agencies who are very well trained when it comes to Medicare. All things Medicare, I refer people to SHIP counselors. I can tell you the basics about Medicare, but if you're trying to make a decision about a prescription plan, I'm not going to be your person. So I will refer to a SHIP counselor. So that's, again, the Department of Aging website, but you can search and even give folks the 800 number. Age Guide is our area agency on aging for Northeastern Illinois, Collier counties. So they have a lot of information on their website. And then in Lake County, you actually have a senior service coalition. And so some of this information may be there as well, and different resources for senior serving organizations. Resources for immigrants, a lot of different resources. I would refer you to this link. The IFRP link will get you to a listing of individual agencies who can give assistance around benefits. And so I know for sure Mano a Mano is on there, Haas's, and some others as well for Lake County. Immigrants who have a lot of questions about public charge, please refer them to protectingimmigrantfamiliesillinois.org. There is a national Protecting Immigrant Families Coalition, but this has a lot of resources for Illinois families. And then legal assistance. I can't stress it enough that when it comes to a lot of the policies that are being enacted, proposed, when it comes to immigration, families need to get authorized immigration advice from an immigration attorney or an accredited representative. And so where do you find that? And so this is one area to find legal assistance. Another good resource is the Illinois Coalition for Immigrant and Refugee Rights. And they have a family support hotline. We call them ICER for short. They have a family support line that is statewide. And so, it's staffed in multiple languages, and they can answer questions to connect them to an agency like Mano a Mano. They can answer questions about know your rights. If someone's been detained by ICE, the helpline can help them get connected to different resources. So it would be, if someone was detained, it would be the family who would be contacting ICER for referrals. So just another incredible resource. And then this is the homepage for the State of Illinois website. They recently revamped it. So they have a lot of good information on the homepage. It's a little more user-friendly than it used to be. So you see the link here at the top and here. And this is me. So wow, lots of information. We have about 6 minutes left, so I would be happy to open it up to questions if you want to unmute yourself. I hope this gives you a little better understanding of what Illinois benefits, kind of some of the things to think about. And then, yeah, but I'm happy to answer questions. And Deanna, thank you so much for some of these lake-specific resources. Right, I'm not hearing any questions, so you are welcome to email me. This is my office phone number, so don't try that right now. I am working remotely. You are welcome to email me. You should have received these materials electronically, so let it sink in if you have a question later. If you get a really hard question through the call center that you don't know, where to refer them, you can certainly try to reach out to me if it's a benefit related question, but your best bet is probably to connect to some of those agencies. And I can tell you that IFRP agencies, while they usually serve immigrants, they do get a lot of benefit training, and if they can't help a family, they usually know who else can. All right, and then Deanna, I'm just gonna reply to your question quick, so don't leave. I'm typing it in. But thank you all. That is all I have for this evening, and I do appreciate you listening in. And thank you for all that you do, and stay well. Thank you.